Loncastuximab tesirine is a medication used to treat a specific type of cancer called large B-cell lymphoma. It is a chemotherapy drug that helps to slow down or stop the growth of cancer cells. This medication is given through an intravenous solution, meaning it is injected directly into the vein. It is typically administered by a healthcare professional in a hospital or clinic setting. It is important to follow your healthcare provider's instructions for the correct dosage and timing of this medication. Taking it at the right time and in the right amount is crucial for its effectiveness in treating your condition. Always consult with your doctor for the best time to take this medication and the proper dosage for your specific needs. This medication is administered through an intravenous injection, typically once every 3 weeks by a healthcare professional. The dosage is determined based on your medical condition, weight, and how you respond to treatment. Before receiving this medication, your doctor may prescribe other medications to reduce the risk of side effects. It's important to follow your doctor's instructions for all your medications. If this medication leaks into the surrounding tissue during injection, it can cause severe damage to the skin and/or muscle. Let your doctor know immediately if you experience irritation, redness, swelling, or pain at the injection site. You may experience tiredness, nausea, diarrhea or constipation, abdominal pain, vomiting, decreased appetite, or muscle/joint pain while using this medication. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. Serious side effects may occur while using this medication, but your doctor has prescribed it because they believe the benefits outweigh the risks. Your doctor will monitor you closely to decrease the risk of serious side effects. Contact your doctor immediately if you experience signs of too much body fluid, such as new or worsening swelling or puffiness, weight gain, chest pain, or shortness of breath. This medication can decrease bone marrow function, leading to a low number of blood cells such as red cells, white cells, and platelets. This can cause anemia, decrease your body's ability to fight an infection, or cause easy bruising/bleeding. Notify your doctor if you develop symptoms such as unusual tiredness, pale skin, signs of infection, or easy bruising/bleeding. It is common for this medication to cause a mild rash, but it may also cause a rare rash that could be a sign of a severe allergic reaction. Seek medical help immediately if you develop any rash. While a serious allergic reaction to this drug is rare, seek medical help right away if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. Contact your doctor or pharmacist if you notice any other effects not listed above. Before using loncastuximab tesirine, it's important to let your doctor or pharmacist know if you have any allergies, as this product may contain ingredients that could cause allergic reactions or other issues. You should also inform them about your medical history, especially if you have had recent infections or liver disease. It's worth noting that this medication may increase your sensitivity to the sun, so it's best to limit your time outdoors and use sunscreen and protective clothing. If you do get sunburned or experience skin blisters or redness, make sure to let your doctor know right away. Loncastuximab tesirine can also increase your risk of getting infections or worsen existing ones, so it's important to stay away from anyone who has a contagious infection. You should also talk to your doctor if you have been exposed to an infection for further guidance. Before receiving any immunizations or vaccinations, it's crucial to inform your healthcare professional that you are using loncastuximab tesirine. Additionally, you should avoid contact with people who have recently received live vaccines. To reduce the risk of getting cut, bruised, or injured, it's important to be cautious with sharp objects and avoid activities such as contact sports. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's essential to talk to your doctor, as loncastuximab tesirine may harm an unborn baby. Women using this medication should inquire about reliable forms of birth control during treatment and for 10 months after the last dose, while men using this medication should ask about reliable forms of birth control during treatment and for 7 months after the last dose. If you or your partner becomes pregnant, it's important to discuss the risks and benefits of this medication with your doctor. The potential effects of this drug on breast milk are unknown, so it's best to consult your doctor before breastfeeding while using this drug and for 3 months after the last dose. It's important to be aware of potential drug interactions, as they can affect how well your medications work and increase the risk of serious side effects. This video does not cover all possible drug interactions, so it's important to keep a list of all the products you use and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This includes both prescription and non-prescription drugs, as well as herbal products. If someone has taken too much Loncastuximab Tesirine-Lpyl 10 mg intravenous solution and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can call 1-800-222-1222, and in Canada, you can reach out to your local provincial poison control center. During your treatment with Loncastuximab Tesirine-Lpyl 10 mg intravenous solution, it's important to regularly undergo lab and medical tests, including a complete blood count and liver function tests. Make sure to keep all medical and lab appointments as recommended by your doctor. If you have any concerns or need more information, consult your doctor for further details. Ensure that you take each dose of Loncastuximab Tesirine-Lpyl 10 mg intravenous solution as directed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist immediately for a new dosing schedule. This medication is typically given in a hospital or clinic setting and is not meant to be stored at home. It is used to treat certain types of non-Hodgkin lymphoma. The dosage and frequency of administration will be determined by your healthcare provider. It is important to follow their instructions carefully. The optimal timing for taking this medication will also be determined by your healthcare provider. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.